So we discussed in previous class that about cardiac anatomy and physiology. Okay. So today we are discussing one important topic, that is cardiac arrest. Okay. So this is one critical and life threatening condition. Okay. So we will discuss about cardiac arrest. So we know that cardiac means heart, arrest means sudden stoppage. Arrest means sudden stoppage. Okay. So means if a person's heart suddenly stop functioning, so what will happen? The patient, the person unable to get the proper amount of oxygen, okay, proper amount of nutritions and carbohydrates, any everything. Means in this two things are very important, oxygen and carbon carbohydrates. So both things will stop because of the heart is not pumping the blood, because is arrested, is it is stop its function. Okay. So basically we know that this is the heart. Okay. Okay, we have four chambers, right side, and this is the right side, this is the left, this is the left. Atrium, ventricle, atrium and ventricle. Okay. We know that in the atrium we have AV node, and the atrioventricle border we have SA node. So AV node will start the pulse, it will give the pressure, it will produce the electricity, it will give the heart initial startup. Okay, everything it will give the AV node, SA node to AV node. Okay, and it will go to the fibers, and it will go to the punctual fibers. Okay, all to the heart. Contraction relaxation will happen. Okay, this is a normal heart functioning. So what will happen here? The SA node and the AV node will work together to contract and relax the heart. But in the cardiac arrest, what will happen? Sudden stoppage of working of SA node or AV node will happen. The electricity connection failure will happen. In that, the suddenly heart unable to contract and relax. There is a no structural issues here. Okay, it is a problem of the electric department in the heart, is SA node and AV node. Okay, so in that what will happen? So basically, why the cardiac arrest is more danger than cardiac failure or cardiac other heart diseases, cardiac issues, because so most dangerous than cardiac uh, failure. So cardiac arrest, it is suddenly the patient will fall down and he will die. So we listen number of stories in and around and in papers. Nowadays it is very common cardiac arrest in more than old age people, rather than old age people. We are seeing in adults between the age of 35 to 50 years. Okay. So whatever may be the reason, Lots of things are happening in and around in our society. Okay, some are talking about taking the uh, COVID vaccine, some are telling about the stress, or some are taking about the drugs. Okay, all these issues. So it will only the last answer. It will be the if we do the examination, then only you will able to find what is the reason. Okay, so this is the correct answer. I hope that rather than telling that is causing the heart arrest, cardiac arrest, that is causing the cardiac arrest. So steroids also causing, okay, steroids, drugs, stress, okay, or work stress, family stress, physical stress, everything. And COVID vaccine, some are telling about that. So basically this is the thing happening. So here cardiac arrest means suddenly stoppage of working of heart. So it may happen for anyone, anytime, any condition. Okay. So this is a mostly physiological condition rather than structural defect. Okay, like we have left ventricle issues, right ventricle issues, septal defect. Okay, we have valve problem. Okay, all these are structural defects. Okay, and or congestive heart failure. Okay, so this we can see that all these are structural rather than physiological. Okay, but here the SA node and AV node is not working. Consider this is due to the physiology of the electric department of heart. So what are the symptoms? I think sudden stoppage of symptoms doesn't have anything to observe about that. We have or the patient will die within fraction of seconds, sometimes in minutes. Okay, if there is if the person will get any emergency or medicine treatment, then he can survive. Okay, like one thing is that resuscitation. Okay, resuscitation in that we will give the pumping mouth to mouth oxygen levels, checking the carotid artery. Okay, and giving the shock to the patient. All this will come and primary uh, getting the patient will getting the primary health help help, and then secondary help in the hospital. Okay, we will call this resuscitation. Okay, I will tell you about. So what will happen, why the patient died? This is the first question. Okay, here anyone can answer. So when cardiac arrest will happen, the first organ which will affect in your body is brain. Understood? Because brain need always oxygen and carbohydrate, glucose. If we stop for 3 minutes, what will happen? Brain death, irreversible damage, okay, will start. So then the all the brain cells will die. So if the heart pumps after death of the brain also, so there are the rare chances of the patient will recover. So what will happen? He will maybe go into the coma, unconscious. Okay, this is the term we use now always. Means his brain tissues, brain cells, okay, are not working. Why? Because sometimes heart is the responsible, and sometimes a brain itself responsible. Okay, so here what we are talking about, heart stops suddenly. It is not pumping the blood to the other parts of the body. Mostly in that, brain is the main organ. Okay, it needs 24 by 7 oxygen and glucose. If you stop anything, it start degeneration or it will start die. Okay, So this is the thing we have to remember. So it will, we have only 2 to 3 minutes only. So this time you have to rescue the patient. So there's the reason we will call this cardio CPR. What we will call? We will call cardio pulmonary resuscitation. We will compress the heart. Okay, in that ribs area, we'll compress the heart area with that our hands. Okay, so what will happen? We will do cardio pulmonary CPR means cardio pulmonary. So this is very important. I think you also saw the video from last past 2 to 3 days that the airport suddenly old man fall. There is a doctor. He suddenly came and he started doing cardiopulmonary resuscitation. So the patient gained breath and he started his life again. Okay, so this is the very good thing which happened. Okay, saving our life means saving a human, means saving entire world. Okay, so resuscitation. Okay, so what will happen in that? We are giving CPR. Okay, I will show you the picture. First, I will show the cardiac arrest picture, then CPR. So you can see this. This is the cardiac arrest and heart attack. So here in the cardiac arrest, suddenly the electrical issue occurs. Means the heart SA node AV node stop working. Okay, this is the thing we have to remember. And you can see other images here. Okay. Mm, okay, this is the CPR. Okay. Okay, checking CPR. First, whenever you see a cardiac arrest patients or any heart attack patient, anything, first you have to call for help. Okay. When you call help, one person will call to the emergency doctor or emergency hospital or any ambulance service. Okay. One person will check the carotid pulse. You have 1 to 3 seconds. You have to check the carotid pulse here. This is the throat area. You will go if you go to the uh, right side or left side, you will able to check the carotid pulse. And you have to check the breathing also. Okay, if you're not, what will happen? You have to chin up and you have to give the sometimes mouth to mouth breathing and starting performing uh, uh, CPR. This is the CPR. You are keeping your uh, all the hands and straight and you are compressing. This is the chest area where you have to compress. Okay, and till the ambulance came, you have to do that. You have to give the breathe. You have to give the CPR. Okay, till the ambulance came to your clinic or came to the your area. Okay, and you have to shift the patient to the hospital. So this is the thing according to the guidelines of uh, ICMR or any CPR. Okay, BSL, basic life support, advanced life support, everything they are giving this type of things. Okay, so in our electrohomeopathy, what we can do if a patient is there, like we have to apply RE on cardiopulmonary area. Okay, okay, and you have to do CPR. This is the basic thing. You have no doubt that means it. You have to give for 60 to 100 beats per minute, 100 or 60 to 100 compresses per minute. Okay, you have to cycles that when you learn about BSL, BLF, BLS, sorry, a basic life support. You have the training portion. in 1 day or 2 day they will teach. Okay, so this basic thing you have to do that. Okay, in the electrohomeopathy, what type of treatment you can give? Initially you have to give the CPR. If you have the RE, you can apply to the heart area, whole chest, and giving you CPR and breathing. It is the must. Then the patient is have to shift to the hospital. Then the treatment will start. The problem will They will find out the problem. They will diagnosis. After diagnosis, you can treat the patient. What is the actual cause? Why this patient having heart arrest or cardiac arrest? Okay, we have number of treatment plan. In that we have S5, A3, B. Okay, this is the initial, or you have to apply after that B on the chest region. Okay, and other things according to the condition. S10, L1, WE. Okay, these are the basic treatment. Other things you have to after that. After we are talking about specific conditions, okay, like blockage, atrial fibrillation, left ventricle atrophy, anything. According to that, you have to treat the patient. Okay, so I hope you understood about cardiac arrest. Okay, let's discuss other things tomorrow. One thing, sorry, I forget that. So this is the mission. You can see that the doctor is operating. Okay, only professionals can do that. Okay, after taking proper. Okay, so this is that. You can see cardio resuscitation machine. Okay, shock that will give to the patient during heart attack or cardiac arrest. Okay, so this is the thing we have to understand. Okay, friends. So this is all about in today's class. So if any doubts, kindly ask.